These mothers are quite young and sometimes they don't keep up with their annual check. My name is Dr. Tan Chong Seong. I'm an obstetrician and gynecologist and a fertility specialist based in Alpha IVF. Once you make an appointment with the doctor, generally we will try to gauge when's the time to do a first scan. So normally the dating scan is best to be done around 7 to 8 weeks pregnant. When you go to the doctor will usually do the ultrasound scan to confirm the pregnancy, and then the one very important thing is to make sure the pregnancy is inside the womb, manage to see the heartbeat. From there also we can measure the size of the baby and the fetus, see whether is it correspond to from your last period. So sometimes if you do the scan too early, it can end up being inconclusive, and then we will set you in a limbo, whether is this pregnancy unhealthy or is it a sign of a miscarriage. Actually, the best case scenario is to do the scan around 7 to 8 weeks time. The first visit is very important because normally it's during this visit the doctor will do physical examination, because generally these mothers are quite young and sometimes they don't keep up with their annual check. So this is an opportunity for us to check them thoroughly from head to toe and also see whether they got any underlying medical conditions that need to be treated. During this time that we will give them advice how to manage this pregnancy. We will give them some idea what is going on, what to expect, what they can do, and things to avoid. And definitely at certain stage we need to do some blood workup to check whether they have any infectious diseases, their blood level, their blood group. And around 10 weeks time we can do a non-invasive prenatal testing to screen through the chromosome of the fetus. One of the most common complications definitely is bleeding. Bleeding during early pregnancy is relatively quite common and doesn't always mean there's a problem, but sometimes it can be a dangerous sign as well. So 1/3 of a pregnant mother will experience some form of bleeding during the early pregnancy. When it comes to bleeding, and when you are pregnant, automatically you will be a bit anxious and worried. You need to make an appointment with your doctor and to make sure everything is alright. Light bleeding or spotting usually is quite common and usually happen for a few reasons. So the most common one is we call it implantation bleeding. Implantation bleeding means that actually the pregnancy is ongoing and trying to expand into your womb lining. So how they expand is like the placenta need to create a connection between the blood vessel of the placenta to the womb blood vessel. During the connection time, it can cause some minute bleed. Second cause is like because of the cervical changes. Cervix is the door to the womb. So during pregnancy, because of the hormone, there are some physical changes and also the increased blood flow to the cervix. So sometimes it might cause some spotting. Pregnancy is a beautiful journey, but at times it can be overwhelming for some pregnant women. But don't worry, we are here to help you.